good morning. I'm Dr. Deuk, and I'm here with a patient who has traveled with her husband from Oklahoma. Where in Oklahoma?
Outside of Tulsa, out in the country.
We did your surgery yesterday for your lower back, and you're here today after having the surgery. How do you feel?
Well, I feel phenomenal. I still have a little muscle, issues from the surgery, but that's going to heal in just a few days. And I feel like my problem has been solved, and a problem that seemed insolvable until I came to Dr. Deuk.
Oh, good. Thank you. Well, that's interesting. You're right. I mean, you had disc pain, and you could see in your surgery we went in with a tiny little cut on your back. We used an endoscope with a laser to clean out those herniated discs. And one of your discs was under a lot of pressure, the L4-5. You can see that it was actually pushing some of the instruments out. It was under so much pressure. And that pressure comes from inflammation. If you've ever seen anybody with an arthritic joint that's aggravated and angry and painful, it's swollen. So swelling is part of the inflammation, and we took care of that yesterday, and you did beautifully. Tell us about your life before your surgery here at Deuk Spine.
My problem happened about 7 months ago. Prior to that, I was perfectly healthy, normal, and then all of a sudden had an injury, and I was bedridden and incapacitated, and I couldn't sit for more than 5 minutes, couldn't stand for more than 5 minutes, couldn't walk for more than 5 minutes.
Why was that? Back pain?
Just the back pain, yes, and the muscle tightness from the back pain. It just was debilitating. It was very debilitating, and that is solved now. It's much better. So.
And you're an engineer by trade?
Yes.
All right, and you must have had an opportunity to talk to other doctors about your back. What did they tell you?
Well, I had a bulging disc. So the normal conventional wisdom, the medical establishment says that bulging discs, you can't really have surgery for those. So physical therapy is supposed to solve those. I did physical therapy for 3 months, and it just aggravated it. So in my case, I was told that surgery was not an option, but Dr. Deuk has an innovative surgical procedure to repair the discs that other doctors do not know about and do not do. And so, but this is actually to solve the problem. It solved my problem.
Is there anything else you want to add?
If you have a condition of back pain and you've been told that you just need physical therapy, but you've tried physical therapy, it's not helping, and you're still in pain, or if you have back pain and you've been told you need a laminectomy or discectomy or fusion, before you do that, you check with Dr. Deuk, because he has an innovative solution that will be much less invasive. You'll be back on your feet, the next day, and you'll be feeling much better the next day, as opposed to weeks or months with the other surgical options. Dr. Deuk has an innovative procedure that's not done elsewhere, but will be the future of spinal surgery.
Absolutely. And no narcotic painkillers for you?
No.
Right?
No,
Tylenol and a muscle relaxer?
Yeah.
All those other surgeries that you talked about, the alternative treatments, they do require post-operative narcotic opioid painkillers, which are dangerous, but you didn't get any.
Right.
Don't need any.
Yeah, don't need any. I'm not sure I need the Tylenol, but so I feel great.
So one last question. Tell us what you're looking forward to now that your back has been fixed. What are the things you're going to do in life?
Return to work and get back to work, because I've been on a medical leave. I'm going to enjoy my animals, able to take care of my animals again. Looking forward to having grandchildren really soon. So now I'll be able to enjoy my grandchildren now, because that are going to be on the way soon.
Do they live close by?
We have some that are in town and some that are far away, but we expect we're going to have grandchildren in the near future. So I'm looking forward to that.
And you mentioned family, so I guess I do have one more comment I'd like to say. Your husband is here with you. He's been so loyal and stood by your side through all of this. Is there anything you want to say about your husband?
He's phenomenal. He's been my strength. Meant so much to me that he's helped me out so much.
He's been supportive.
Yes, absolutely.
And understanding.
Absolutely.
A lot of people aren't fortunate enough to have a spouse that understands. Unfortunately, and we talk about this in my surgeries, there's a lot of stigma associated with people with back pain. The rest of society sometimes labels them as slackers, or they're just trying to get out of work, or they're just faking it, or looking for secondary gain, but it's not true, is it?
No, I mean, I was miserable not being able to do anything and not being able to take care of myself, and now I have my life back, so, and I can be a productive person again. So I can't tell you how much that means to me. So.
You have your dignity back.
Yeah. Mm-hmm.
Well, thank you so
Mhm.
much for sharing your story, and I'm sure it'll inspire other people to
Yeah.
get something done to
Yeah,
fix their
yeah.
back.
Yeah, check with Dr. Deuk. You could have a virtual appointment to get started and go from there. So,
Well, thank you for
thank
sharing.
you. Thank you.
Congratulations.
All right. Mhm.